Good afternoon, everybody. We are excited to be here with you this afternoon to be talking about one of our newest resources on the STAR Center, and it's going to be our Strategic Planning Workbook. So thank you again for joining us. I hope you are all staying warm, depending on where you are in what part of the country you are today. I know a lot of people are experiencing some bitter cold, so I hope where you are warm and toasty. Okay, so for most of you, you're familiar with the folks at the STAR Center, but if you're not, or if it's been a while since you have taken a look at our website or used our resources, we'll go over that for you guys today. So our website is chcworkforce.org, and you can find the Strategic Planning Workbook along with all of our other tools and resources. We have some wonderful and fantastic resources that we hope you guys will take a look at when you're downloading this particular workbook, and that's where you can find them. And I just wanted to introduce the STAR Center team. So I'm Suzanne Spear. I'm the Director of Workforce Development here at the STAR Center at ACU. And we have, with me, we have an all-star team. So Allison Ave-Sacra is our VP of Training and Programs. And then Mariah Blake is also on our team as well. And she is our program manager, and she keeps everything running and all of the emails going. And so you most likely received your email for this webinar from her today. So, and just wanted to let you guys know that you can contact us at any time through our email or phone. We're always here to answer questions that you guys may have for us. We are absolutely thrilled today to have one of our very favorite friends with us today, Pamela Burns. She's a senior consultant with John Snow, Inc., and she has worked with us on a lot of our projects here at the STAR Center. So along with our core team, we have some other folks that we couldn't do our work without, and Pamela is definitely one of those. She worked really hard on the Strategic Planning Workbook and is going to be talking to us today and walking through that. Before I hand it over to Pamela to take us through the workbook, I just wanted to go over some webinar housekeeping items. So just to let you guys know, we are recording this webinar. If for some reason you have to hop off before the end or want to recommend it to a colleague, send it out. It will be archived on our website, so you can find it there with the Strategic Planning Workbook page. And also feel free to ask questions as we go along. You can either raise your hand and let us know you have a question that way, and also use the chat and the questions box. If you have any, email difficulties or connection problems, feel free to email Mariah, and her email is mblake@clinicians.org. Two other really quick items here. So if you would like to download the PowerPoint for this presentation, you can download it in the handout section of your go-to toolbar. And also, too, at the very end of our webinar, once you log out, you're going to receive a quick survey is going to come up. And if you guys could fill that out, that would be fantastic. So now that we're all through the housekeeping items, we're going to move on to strategic planning. And before I hand it over to Pamela, I just wanted to mention that for those of you who've been around ACU and the STAR Center for any length of time, you know that we're all about having a data-informed workforce plan for your recruiting and your retention. And so I really like this graphic because it just really shows how the process goes. So, obviously you have an idea, you want something to happen, and then there's some steps you have to take along the way in order to get through and to get where you want to be and that success. So keep that in mind as we go along. And, I think also one of the things I wanted to mention too, strategic planning, it's a big phrase, and it really carries a lot of weight with it, but we don't want you to be intimidated, and Pamela is going to break it all down for you, and really is a simple process, but there are some really specific steps you have to take along the way in order to achieve your success. So without further ado, I'm going to hand it over to Pamela, and she is going to go over our strategic planning workbook.
Well, she's going to try to figure out how to move things along for sure. Hi, everybody, and thank you so much for joining us today. For those of you who know me, strategic planning is something that I feel is critically important in many, many aspects of what we do. If you think of it even on a personal level, you know, generally you do better if you go to the grocery store with a list, and the list is based on some idea of what it is you're going to want to be making over the next week or so, than it is to just walk in the grocery store and randomly pull things off the shelf and then get home and wonder, gee, do I have what I need? Do I care about what I bought? So I think it carries over into all areas of our life. And as Suzanne said, it really sounds like this big, intense, heavy, different thing, but it's really what we do every day in all the different aspects of our life. But particularly for community health centers, it's a really, really important thing to be doing. And at this point, the Bureau and HRSA require you to do strategic planning as an organization at least every 3 years in order to be compliant. You might want to check that in the compliance manual. But what often doesn't happen is that we, at the same time, are doing strategic planning organizationally and probably some strategic planning financially to get you to the end of that 3-year plan. We often don't really focus on recruitment and retention. We say during the strategic planning process, oh, well, yeah, we got to make sure we have enough providers or enough of this or that, but not necessarily conscientiously or consciously engaging in workforce strategic planning. So that was why we actually got this thing together. And I do want to just step back for a second and acknowledge the fabulous work that the STAR² Center does, Allison, Mariah, Suzanne, and we have several people at JSI at John Snow who have been involved since the inception of this, and it's just been a huge learning experience for all of us. So kudos to them for the great work getting done. Okay, so what is strategic planning? It's a disciplined effort. It's not just random, like I said. Put it over there into that grocery store thing and think about, how is my health center going to be responsive? We always have to be reality oriented. That's what Suzanne was just mentioning. We're grounded in data in order to do planning that's responsive to the needs of the community, which is the reason that health centers exist to begin with. And thirdly, to make sure we're ready. So we're not doing crisis-driven actions more than is necessary by actual crises that arise. So as part of going into this exercise, we want you to be strategically ready for it as well. So you really want to take a look at what's in the workbook before you get started. Identify who it is that you want at the table with you. Who are you going to need and want there to be able to have the discussions around the community need, the patient's needs, the environment around us, and really doing some meaningful planning that has an opportunity to actually come into fruition. So who are those people, the leadership team that you want at the table? And making sure, and I'll talk in a minute about the companion tools, which provide you with the opportunity to delve more deeply into a lot of these areas. And then finally, making sure that you have a timeline for completing it, that this isn't something that gets done on the, you know, maybe if we think about it, we ought to do the next section, but rather this is a coherent workbook that is meant for you to sit down and to go through in a timely manner in order to develop what you'll see at the very end, a really organized and focused strategic plan for workforce. And now they tell me I can move this somehow. Okay, let's see. There we go. No, come back. The PhD wasn't for technology, I can guarantee you that. So when we're entering into strategic planning and doing here, what are the different things we're doing? We're trying to look at internal factors, mission, vision, and goals, the patient experience, present scope of your project, your contract with the federal government, and your present workforce status. And we're balancing that against external factors of what's going on in the broader environment, the socio-demographics of the community, the different policy and payment trends that are going on, and certainly workforce trends in terms of supply and demand out there in general, but also in terms of other policies that might actually impact in a significant way on your ability to do planning around workforce. And we're going to get into each of these more deeply over the next probably half hour or so. Oh, and I can move this. Did it work? Yes. So basically, every different section, every different factor that we're going to be looking at has pretty much the same process connected to it. And in the workbook, there's actually very specific questions that go with each of the different factors that we're going to be looking at. So I'll cite some of those as we go through, but thinking about the myriad of different ways that, first of all, you define that factor. Secondly, you're going to collect and analyze data, because we do have to be grounded, and data is quantitative as well as qualitative. And so it's important to make sure that the input comes from both sides of that. Next, you want to have a conversation. This is about talking about ideas, working through potential options, getting different opinions on what are strengths and what are challenges, what are options that are out there, how do they relate to the different strengths and challenges. It's really important to have that conversation and then to move on and make an actual plan. And at the very end of the webinar, we're going to show you some tools that are included in the workbook to allow you to actually develop the action plan for workforce strategic planning. So first of all, before you even get started, as I said, you want to put together your team. You want to walk through this workbook to see what kind of information you're going to want to get. But you can really get a head start on it. And also just because each of these tools that are on the STAR² website are really, really good assessments for you to do anyway. But they will help you by augmenting the information that is specifically asked for here, kind of giving a broader picture or fabric to your discussions, but also because a lot of the data that's in here, that's asked for in here, you can get by doing these other things. And they have the benefit of focusing on different areas, but at the same time contributing meaningfully to your strategic planning process. Okay, so the first thing is, and we're going to do, as I said, internal and external assessments. The first part of the internal assessment is mission, vision, and goals. I love this quote because if you don't know where you're going, any road will get you there. But on the other hand, you don't know where you are. So the first thing you want to do is take a look at your mission, your vision, and your goals as an organization, which should have been developed the last time you did your overall strategic planning. And it's probably also another one of those good moments to stop and say, are these still, what we're focused on? Just as a reality check, because mission and vision and goals are also moving targets depending on what's going on in the broader environment. So you want to take a look at those and see. And then take a look at your present workforce challenges and strengths as they relate to those, to mission. What is it we're supposed to be, we say we're doing now? And if we say we're doing X, Y, and Z services, do we really have the workforce that addresses that? Where might we be not really fulfilling our mission or heading in the direction that will get us to our vision? And it says values there. I meant to put goals, but that's okay. It's your values as well. Are you living the, does your workforce reflect the value of being culturally competent, as well as your goal to be able to bring down type 2 diabetes in 20% of your diabetic population? So both of those go as well. Then discussing how to align your workforce to support your mission, vision, and goals, and then to develop a model for the future. You're going to see where these same steps occur over and over again, focus on a different factor so that at the end you can kind of meld them all together and see overall where are your strengths and where are your challenges. So if you look down from 30,000 feet, how are we doing on each of these? Do we have strengths in pursuing our mission statement? Do we have challenges? How does it look when you're just looking down from that higher view? And what do we need to do to fix that or make it work better? The second area of the internal assessment is the patient experience. The patient experience in the assessment portion, you want to be looking at quantitative data. So those are your trends. Are patients, is your patient census going up or down? Things in your patient satisfaction surveys. What are your wait times, cycle times for visits? The usual things you look at internally, your total visit cycle time, your drop phone call rate, continuity of care with providers, all those different kinds of qualitative aspects that you like to, that you should be collecting to understand what the patient experience is, often to understand how efficient your organization is as well. But then looking at patient satisfaction, what are the positive things they say? What are the negative things they say? Picking out those most salient ones that patients have brought up themselves. And are we gaining or losing patients? Then some of the qualitative data, and we like to encourage people to actually do patient exit interviews, to maybe randomly pick out different patients, ask them if they'd be willing to sit down and talk about why are they leaving? Or even patient stay interviews. Why do you come here? What do you like here? So that you get a real feeling for that patient experience. Then analyzing your workforce challenge and strengths based on the information that you've gotten from your patient experience, whether it be the responses of the patients, their senses of what it's like, what's important to them or not, as well as the different quantitative aspects of it, and then talk about it. How is this helping you understand what it is you should be thinking about? So the patients are leaving because there's a whole different population that's moved into town, and people don't seem to be culturally competent in your practice, so they don't feel very comfortable. So what is it we need to plan for in order to address the challenge that has been but we're confronting because we have a new population? Conversely, people really have hooked on to nurse practitioners. So, it's really great that we have those, and people are very happy with their nurse practitioners. They tend to stay longer and they have more continuity of care. So therefore, we're going to really be highlighting recruiting in the future, looking toward nurse practitioners. I'm just throwing that out there. So the conversation happens after you get the data, you analyze what it has to say, and then you talk about what it is you need to think about in the future based on the patient experience. The next internal assessment is your contract with the federal government, better known as your scope of project. This is really important because not only is your contract with the government, but it's also the contract you made with yourselves after having done your needs assessment and figuring out who's out there and what they actually need. So the first assessment, and we're giving you here an example of a little table that you can use. It's very easy. On this one, we just put in the three, overall clumps, if you will, of services: primary care, behavioral care, and dental care. But you can take this as deeply as you want. And I'm a real stickler for going as deep as possible, because when you're trying to figure out if you have a problem or where your strengths are or where your challenges are, you really need to go inside. So primary care covers a whole lot. It covers prenatal, potentially, pediatric care, adolescent, adult, geriatric, different kinds of primary care inside that big bucket. So I would encourage you to take this as just a prototype, but to really dig much more deeply into your specific services And you can even go by service by site if you really want to do a thorough job of it. And that will help you to see, where is the staffing? Where are there problems, first of all? Why do you have fewer dental patients than you had projected that you would have? Is that a staffing issue? Is that we don't have enough dental operatories? Is that people aren't doing referrals from primary care to dental in-house? What might the reason be that that's going on? Is it a staffing issue or something else? By the same token, in the scope of project assessment, we want to look at where you are in terms of demand and capacity. And I have to give kudos to Ann Kaufman-Nolan, who is the CEO of Hudson River Health Center. She's the one that showed me this tool, which they actually used in focusing on their strategic planning and internal balance first. But this is looking at, by your sites, by your services, what's going on. So actually, again, getting inside of, if we're not in balance with demand and capacity, is that a staffing issue or is there something else? So having that same conversation that you had across the services, you now expand to across the sites. And again, getting as deep into the sites as you can in order to get the most specific and salient information and to, as I say, really peel off the layers of the onion and understand what's going on inside your practice. After you've gone through these two exercises in particular, what would be the ideal staffing to be able to align with the scope, both in terms of your volume for each of your services and across your sites, to make sure that you're really meeting the needs of the population and the goals that you established as your organization. And then develop a plan through that conversation. What does that ideal staffing look like? How is it that we can best go about planning on ensuring that we are fulfilling our obligations to our community and to the federal government, of course? No questions. I keep forgetting to look for questions. Here we go. And the final part of the internal assessment is your present workforce. And this is one of those places also, particularly where those other toolkits that we mentioned at the beginning of the webinar that you want to make sure and go to, because a lot of the questions around present workforce is stuff that you would have or should have been collecting through doing those different tools. And what we're interested in looking really here is, how stable is that workforce? How long have people been there? What do you project over the next 3 years is going to be the stability of the workforce? Who's possibly going to be retiring? Looking first at just those very basic characteristics of your staff. Who's going to cycle in? Who's going to cycle out? Are you online for more National Health Service Corps folks? All different questions like that. But then also, what is your turnover rate in each of the different provider categories? So that's by type of provider and by type of service that they're providing. Maybe even by site. Maybe if you look at sites, you're finding that you have bigger turnover at one clinic site than you do at others. Well, why is that happening? Trying to figure out, can you stabilize high turnover? In your conversation, looking at that, what are the priority areas that you're left with after you have the analysis of what's going on, talking it through and figuring out the internal and external resources and strategies that you're going to need to do to make sure that your workforce is adequate and stable. So that goes also into your employee satisfaction surveys as well. So making sure, again, that looking at your organizational needs, looking at your scope of project, that you are in fact staffed appropriately or developing a plan that will meet the internal assessment of your present staffing. So now we're going to turn to the external assessment. The first thing we're going to look at is your population trends. And in general, it's your environmental trends as well. So this is the ever popular needs assessment that you do at least every 3 years, although those of you who have heard me speak before will always hear me say that doing a needs assessment is an ongoing process, not an event that happens once every 3 years, and we want to be always taking a look at what's going on in the environment. But so this will be made up of your population sociodemographics, who's out there, what are the health status indicators, and in the toolkit we have extensive tables that you can fill out by sociodemographic, age, income, race, ethnicity, insurance status. And we ask you to look at what is the present status, and then for each of those factors, each of those traits, to also look at the trend from the previous data that was reported on that same factor. For health status indicators, we have the same kind of tables. They just go through some of the salient health indicators that we look at as health centers: childhood immunizations, low birth weight, chronic respiratory disease. But these should all be modified as well to fit your specific populations and the information that you think it's important to have. For example, language competency, competencies, or whatever else you feel is an important characteristic for you to plan your workforce needs in addressing the needs of your specific community and the goals and the mission and vision of your health center. The service area providers, so the population demographics is who's out there. The health status indicators is what do they need, what kinds of services. And the service area provider characteristics are who's out there. Are there enough of the kind of providers that we need to be able to address the problems that have been identified in our target population? So that's where then you all sit down and you say, okay, given what we just learned externally about the community and the environment in terms of the characteristics of the population and the service provider population, what is it that we need? What is the ideal staffing profile in order to meet those emerging needs, along with our mission, vision, and goals? So again, we're always relating back to the internal structures and goals, but at the same time, as I said at the beginning, since mission and vision and goals are moving targets, this is part of helping to understand whether or not you're moving in a good direction, and if the direction you're going in is good, are we going to be able to get there by developing what would the ideal staffing profile be to meet the emerging needs of the population and the environment. The second aspect of the external assessment is your policy and resource environment. And with this, and as well as the next one that we're going to talk about in a couple minutes, we really want you to consult with your state and local policy experts, your state and regional primary care associations, and your national associations. The National Association of Community Health Centers, there are, I think, somewhere around 17 national cooperative agreements, of which the STAR² Center, ACU, is one of those. There is quite a few others that either deal with specific substantive areas. John Snow has one for high tech, which is all about using data for quality. There are, for each of the special population groups, there are numerous different state, different national cooperative agreements that have just tremendous ability to help you a lot of resources. So it's really, and of course your state policymakers are important as well. So looking at what's changing in terms of overall state policy, how would that, are they changing, well, Medicaid, obviously expansion, the Affordable Care Act, all of the stuff around that is a huge ball of wax to be taken apart in terms of looking at what's going on in the environment. How about the resources? Not just for your, not just the resources from the feds, but what other kinds of things are changing that you might be presently engaged in? Different grants that are out, opportunities that are out there, not federal necessarily, local things that are changing, different ways that people are choosing to give. We did a study for a large national foundation a couple of years ago that looks at what are the changing priorities of giving for large foundations, the grant makers in health. So there's changes that go on in those environments. But then specifically also the reimbursement environments, certainly Medicaid, Medicare, what's going on with payment reform. Are we really moving from paying for widgets to paying for quality and outcomes? What's happening with Medicaid reform and the Affordable Care Act? And I actually was just talking with my husband, who's very involved with the state of Rhode Island. There's legislation up right now to change the way managed care organizations have to pay community health centers for Medicaid recipient services. So that's going on in a number of states, shifting costs, if you will, from the feds to the states to the plans, all over the place. So those are important things to really understand because, of course, the reimbursements are your lifeblood. But then also the delivery system changes. All the things that went on under the Affordable Care Act with the patient-centered medical home, the health homes, the affordable care organizations, mergers all over the place, Pac-Man activities, looking at the way that hospitals, for example, are starting to really get deeply into primary care because there's better reimbursements coming. And that whole thing needs to be pulled apart. You need to understand what's going on. And how does that affect your organization and your workforce needs? I think probably there isn't a health center out there that hasn't experienced the increased competition right now from larger healthcare systems, which are continuing to eat up each other all over the place, and how the competition for primary care providers is impacting the availability as well as the cost of getting primary care providers, particularly physicians at this point. So really having a very in-depth analysis of how all these different environmental policy and payment trends and delivery system reorganizing are impacting your workforce needs and your ability to plan, and then discussing what are some of the ways that you can successfully try to navigate that changing environment as it relates to workforce, getting ahead of that curve again and trying to not end up in crisis mode, constantly going for locum tenens, which, as we all know, is more expensive and doesn't necessarily provide the kind of continuity of care that you'd like to give your patients and your providers. And then finally, the external assessment is of workforce trends. What is going on out there? Again, we ask you or encourage you to consult with and use your policy experts, your state and regional primary care associations, all those national associations and national cooperative agreements, because they do have a lot of resources and knowledge that they can help you with. So what do we want to look at? Funding. What's going on with federal and state funding in terms of workforce environment? So what about the National Health Service Corps? Is it getting refunded? Is it getting expanded funding? How about graduate medical education, teaching health centers? What's going on with all these funding sources that are pipelines for you to be able to get more providers into your shops? What's going on with policy? Licensure. The whole thing going on in oral health right now, there's a lot of what we went through in the primary care side of physicians, physician's assistants, advanced practice nurse practitioners, nurses, what are their scope of practice? We now see that emerging also over the last few years in the area of oral health and behavioral health. So looking at licensure, scope of practice. And then the other big bucket of policy, which is huge right now, which is immigration. Immigration policy has a significant potential impact on workforce environment, the availability of people to be able to be providers in your health centers. J-1 visas, all of them are really, at this point, it's a very dynamic area, shall we say. Things are moving very quickly all of the time, so it's important that you understand that. So this is where you go back to that ideal staffing profile that you have been developed at the beginning. been honing as you go through the whole exercise. And now you have this final step of saying, given what's going on in the broader workforce environment, how is that going to impact where it is we said we want to get to by the next 3 years, and also planning for the future vision that we have of our health center. And then sit back with your folks that are at the table and discuss what strategies you need to do, you need to use in order to be able to achieve that staffing pattern and meet the needs of your community and of the goals of your organization. So now we've collected a bunch of data. We've collected a lot of input. We've analyzed it, sitting around, taking apart the data, whether it be qualitative or quantitative, and one is not more important or valid than the other. They're both equally important and valid. We've talked a lot about the different aspects of workforce planning and strategizing. What is it, where do we need to get to for each of these different things we need to accomplish, and what's impacting our ability to get there? So now what we're going to do is we're going to sit back and take a breath. You've gone through this process, hopefully in a contained yet timely fashion, but you've had a lot of input, you've had a lot of discussion. So now let's just sit back for a few minutes and talk about it, think about it. All of the different things, factors that you were pulling apart and piecing back together into this ideal look at what it is that your workforce should look like now, should look like in 3 years, should be moving toward as you move toward your vision 10 years from now. So your mission, are you there? Why not? Are your patients being served? What's working? What isn't working? On your vision, are you heading in the direction? Are you working towards your goals? Do you have staffing that's working for you to get to those places? Are you fulfilling your scope? How's that trending? Are you going up or down in patients? Why was that? Did we find out what that was? Is there any thread that's running through all of these that you happen to notice that there's some kind of similarity, there's specific service area where you're not quite accomplishing what you had hoped to, or what you thought you were going to do doesn't seem to fit anymore with the community? Making sure that you've picked out of all those different pieces, and now having that conversation. And then, well, what's changing in the broader environment? What are the trends? What do we have to, watch out for? Where are the blocks and barriers to moving forward? Where's the things that will augment or help us get there? After you sit back and take a breath, analyze it, figure out, do you need more information? Do you need different information? Can we really reach a logical, realistic, attainable, goal-focused, measurable strategic plan? And here come two different ways, two different tables, matrices that we're offering to you in this workbook to be able to start pulling together and getting a strategic plan going for workforce needs. The first one is the summary of your assessments and discussions. So as you go through each of the areas, and maybe you actually came up with a couple other factors that you really want to put in there. You really want to look at something else as well, and how does your workforce, how well is it working, or what needs to be done in relationship to that other factor. Mission, what were your strengths and challenges of your workforce that you identified, and what are you projecting that you're going to need? Patient experience, your present commitments, that's your scope of project. The changes going on in your community, your population changes, the environment of your resource, of your policy, resources, and service delivery system changes that are going on, and your goals and your vision. And I guess I thought vision was important because it's there twice. We might want to fix that. After you've gone through there and identifying your projected workforce need, you're ready to go on and actually do the time-bound, measurable, achievable, realistic strategic plan for workforce. You take that last column back over to each of the different areas, the factors that you analyzed, and you have your projected workforce. You have the action step that you've determined that you're going to do, the strategy. And there's many, many action steps potentially for each of these areas. So don't let it look like, oh, we only need one action step to fulfill our mission in terms of workforce. That's not how it works. You keep putting them down as many action steps as you need to accomplish the goal, which is that projected workforce need. What resources are you going to need to be able to do that, whether they be in terms of your own staff, bringing in outside expertise, doing a realignment of your clinics to be able to focus more on dental versus primary. I just made that up, whatever it be that you realized when you did your analysis of your different sites and your expectations for them. Who's leading it? What's your timeline for getting it done? And how are you going to evaluate whether or not the outcome has been achieved? And again, this is all a moving target. It's constantly changing, so that you want the roadmap to be consistent with getting you to where you want to go, and you need where you want to go to continually be tested against the changes that are going on in the environment, so that you can make sure that you're moving along with your community and with the broader environment toward goals that are realistic and responsive to your community. And that is what I have to say. Any questions or conversation? We're open to anything you want to say. I think that's the end, right?
Yeah.
Stay in touch.
Thank you so much. Yes, thank you so much, Pamela, for that fantastic walkthrough of strategic planning process and really sort of breaking it down into really accessible pieces. As we both mentioned, it seems like this elephant in the room. We're going to talk about strategic planning, but that was just a fantastic breakdown of all the things you need to be considering, both inside and outside of your health center.
Thank you.
And I don't think we have any questions. Thank you, everybody, for joining us today. If for any reason you think of a question after this webinar is over, you can email us at info@chcworkforce.org, and we'd be more than happy to get back to you just as soon as we can. And I believe that is it for today. So thank you guys again. Have a great afternoon, and we will be talking to you guys soon. Take care. Thanks, Pamela.
Thank you, Suzanne. Thank you, Mariah. Bye, everybody. Thanks for joining us.